Meeting will please come to order. Counselor Legg, would you like to lead us in the invocation?
You bet. Lord, we thank you for this day that you bless us with. We ask that you keep your hand over each and every one of us. Lord, we want to thank you for our veterans that served for our nation, protect this country. God, we ask that you just stay with us throughout the day. In your wonderful name we pray. Amen. Amen.
Mary Baker Shaw.
Ani?
Mike Dobbins.
Here.
Keith Austin.
Here.
Holly Bezer. Here. Joe Bird. Julie Coates.
Here.
Sean Crittenden.
Aye.
Joe Deere.
Aye.
Anna Duncan.
Aye.
Rex Jordan.
Here.
Darrell Legg.
Here.
Wes Snowfire.
Amen.
Laura Petzkowski.
Here.
Mike Shambaugh. Denise Taylor.
Here.
Victoria Beswith.
Ani?
Would you
Good afternoon. Speaker. Yes. Okay, has everybody read the minutes?
Make a motion to be approved.
Motion made and second. All those in favor say aye. Aye. Okay, into reports. Mr. Valier. Is it right?
Yes, you
I said it right. George, I'm going to learn to speak French yet. Is that French?
I think it is.
Beautiful name. I just kind of messed it up.
Good afternoon.
Good afternoon, George.
I think you have, you've got my short little report in your packet. In dental, we had 802 patient encounters in September. The lab had 2,261 patient encounters, ran a total of 11,651 tests. The outpatient pharmacy filled 28,226 prescriptions. We mailed out 8,219 scripts. Physical therapy saw 170 patients. Radiology saw 2,350 patients. So it was busy month.
Wow. That's quite a bit. How's your new emergency room?
It's going well, We're refinishing the parking lot out back, redoing that. It's been a couple of years coming, so redoing that, kind of making it a little nicer, a few more spaces to park out back for the emergency room and physical therapy. It's going well.
Does anybody have any questions for Mr. Miller? I have one. Your patient visits were up like almost 20%. Do you know what the #1 diagnosis was?
I don't right off the top of my head. I sure don't, but I'll find out for you.
It would just be interesting to see if your figures are similar to what we have
Okay.
inside jurisdiction. Yeah, but up 20%, that's something. Anybody else? Yes, I'm Counselor Austin.
George, I noticed just west of your parking lot, your front parking lot, over into the expo parking, there's a substantial number of vehicles that I believe are probably your employees that are parked.
They are.
Do you have an agreement with them? How's that work?
The city just lets us park there. It's
Okay.
just open parking.
And if you didn't have that available to you, what would happen?
We would be squeezed for parking spaces over on our lots.
There's a lot of days when your parking lot is so full
Yes.
that it's difficult to find a place to park.
Yes.
But it's just a gentleman's agreement right now. It's not a,
Yes.
you don't have any
No.
financial arrangements or anything
No.
with the city.
No.
Okay. If they start using that property for anything, it would cause you a problem, wouldn't it?
It would.
Okay, that's all. Thanks.
Okay. Anybody else have any questions? Mr. Valier, thank you for coming down
Thank you.
today and seeing us. Appreciate it. Okay, Dr. Steve Jones, Cherokee Nation Health Services.
Good afternoon.
Hello. Good afternoon.
Call your attention to some of the things on the report, and then I have some other things I want to report to you before we get into questions, if that's okay.
Please.
The diabetes program has been awarded full recognition from the Center of Disease Control. That's an annual accreditation that we were the first ones to get that, so just wanted to call attention to that, and that's on your first page of your report there. A couple other things in the report that we look at routinely is the vacancy rate, 6.5%. You can see that as compared to IHS at 25%. Referral approval rate, 98%. I think last month it was 97 point something, so we kind of stay between that 96 and 98% approval rate. So you can see that that's up for this month. The next page, you can see that this is our kind of end of report that shows for a full fiscal year. We end up about $9 million there above on revenue than what we projected, or over the year of 2018. But if you look back over on to contract health, we were about $7 million overspent. So we end up coming out okay on that, and that's where a lot of that money goes from that third-party revenue. And then if you look at dental services, from this year compared to last year, we were up in just about every category except emergencies or walk-ins, and we stayed relatively close to the same, even though we had one clinic that was down in Stillwell. So they were able to pick up a lot of the need in Salisaw and in Hastings. And when we get Stillwell back up and running again, of course, we expect those numbers to climb.
How soon will
considerably.
that be?
Well, when we get our new clinic built. I don't know the exact date. I know I can give you an update. I'm going to give an update on the construction here in just a second on that, okay? And then the rest of your report, this time you got the diagnosis by, top diagnosis by clinic in the part of the report that revolves each time. So a few things I want to kind of give you updates on is we are in the midst or just about to the end of a reorganization process in health that's going to help us to be more efficient and allow for our clinics to increase access by moving toward care teams rather than individual providers. So that's something we're working on that you'll be hearing about as we move forward. We're in the preliminary stages of putting those care teams together and restaffing for those. There won't be any jobs eliminated. We're just going to repurpose and try to build our teams around our providers so that if we have someone who does leave, when they fulfill an obligation or something like that, because we do have those scholarship recipients that when they fulfill their obligation, they sometimes stay and sometimes they leave, that the patients don't fall through the cracks, that they'll be assigned to a team rather than to an individual. So we're going to be moving toward that model as time goes the next few months as we move toward a new design on access and efficiency. Okay. We've been reviewing all of our service agreements with different entities that provide service to our patients. So you may hear of some contracts that change. We're looking to try to make the most out of our contracts for Cherokee Nation. Not always have we been in a position where we've been able to be on the strongest side on negotiations. We are now, and we feel like we can make some of those agreements a little better for our patients and for us financially. So you may be hearing something of that nature coming down the pipe, and if you do, just let me know and I can give you the the truth about what's going on. A lot of rumors fly around, and I've heard some stuff that we were getting rid of people and we're getting rid of employees that have been with us that work through different entities, and I assure you we're not doing that. We are just looking at what's best for Cherokee Nation and what's best for our patients. The transition continues to move forward. We've opened up today orthopedics and podiatry. Those service lines opened up today on the first floor, and I was just talking a little earlier today. It's getting busier in our clinic as we go. We've had some other things on the first floor open. This is an additional service line, so now we've got a lot more people moving on that first floor. The last service line we opened up was on the fourth floor, so we didn't see that as many people moving around as we did today. So it was pretty busy and pretty hectic this morning, and we've been working with career services to have greeters and wayfinders, and they've done a fantastic job for us helping patients find their way to where they need to go. So hopefully you'll get to see some of that in action this Thursday when we have our grand opening. Flu season's going on, as you know. You've seen that on the news. It started a little earlier this year than it normally does. We've seen several cases, and of course we have the flu clinics going on where we can get vaccinations done. So I think at each one of the community meetings and even the veterans festivities this weekend, we had someone there doing flu shots. So if you need us, just let us know, and we'll try to work our best to make sure we get as many people vaccinated as we can. Stillwell Construction, let me give you a little update on that. So you should see the contractors' trailers moving in pretty quickly. We identified this last week the parking situation. We're not going to take as much parking as we originally thought. The contractor has been good to work with us and pare that down quite a bit. We're going to have quite a bit of patient parking still, and we're going to have a limited amount of employee parking. So the incentive is to get there early enough to get some of that employee parking. Otherwise, we'll have the shuttle going. So, but there are going to be designated areas that are patient only, and we're going to try to get some type, since it's further down the hill, some type of transportation to make sure those patients aren't having to walk up that hill all the way up to the door. So we're working on that now. Okay. The pharmacy is our holdup, trying to get our pharmacy certified in the trailers, and also getting Script Pro, which is the entity that moves the robot, getting them here to get that done because they're in an end-of-year type schedule. So we're kind of working with them right now. It's toward the end of December before they're going to move, but we're trying to negotiate and get them soon. Okay? But until that moves, we can't start the demolition. So we're kind of at a standstill until that piece gets done. Okay? All right, and that's all I have. So.
Counselor Shambaugh.
Has there been administrator hired for the J Clinic, or is that still open?
It's still open. It's in interim position right now. We will not probably advertise that and open it until we get the reorg completed, just to ensure that we have all the pieces in place. So, but Arowanna's doing a good job in keeping everything. I've heard nothing but good reports back since she's been in there.
They were kind of saying they wish she would come over there. But
And that's something that she'll have to decide, and when that time comes. But right now, she's been doing a great job.
Counselor Vasquez.
Yes, Dr. Jones, do we have the audiologist up and working yet at the new clinic?
We do. We actually have 2.
Okay.
Yeah.
I have a citizen in my district that asked me over the weekend how she could get in to see them. She went to Claremore and was not happy with whatever. And I said I would find out. Does she need to be referred, or can
She needs to be referred in by, typically it's from one of our providers. They usually come in for an initial evaluation, and then they get a referral into audiology, and then the audiologist will schedule that appointment after the referral's been done.
Okay.
And, okay?
Thank you. Thank you.
Counselor No Fire.
Yeah. What's our percentage of our IPA contracted employees that we have?
That I'd have to get for you. I don't know that for sure.
Okay. Just kind of had some concerns with some of those. I know we've had, like you said, we've had several employees that's worked for us for a long time. I get phone calls quite often on other issues, and I just didn't know, what's our benefits of having IPA contracted employees? Is that something that you can discuss, or is that something you can email me on benefits and cons of why we'd have an IPA contracted employee working for us?
So my understanding, the history on IPA employees typically was these were employees that were currently working at Hastings Hospital before it was assumed
Right.
by Cherokee Nation. The agreement through the compact was that they could stay in an interpersonal agreement, which that's what the IPA stands for,
Right.
indefinitely. There was not a timeline set at when they had to either transfer to another federal facility or become a tribal employee. Typically, my understanding is most compacts have a deadline
Right.
that's set. There was not one for ours, so
Right.
the ability is for them to stay. But the downside to being an IPA is you cannot advance.
Right.
Those positions are frozen. So
Right.
once they leave our system, then that transfers over to a tribal position.
Okay.
So, but currently they are stuck in a position that does not allow transfer or does not allow promotion, and it's just frozen at that salary level and at that job title.
If we, for whatever reason, decide not to renew an IPA contract, like I said, I don't really know the reason why we wouldn't. Or is there any opportunity that we can offer those employees that's worked with us for a long time a contract to come back and work for us through Cherokee Nation Health Systems instead of working through IHS.
So
IPA.
whenever someone leaves our system, then we open it up through HR, and it's, anybody can apply for that position that is qualified for that position. We don't actually move people in and out of those positions. It goes through an HR process, just like any other position that comes open. It just shows as a vacancy, and we open it up as a new position.
Okay, I think that's just kind of where the concern I'm at is if we lost some of our employees because of the IPA not getting renewed, to be able to get those employees that's worked for us for a long time an opportunity to stay working for us by going through Cherokee Nation Health contract instead.
Yeah, and typically those when there is someone who separates from us as an IPA, then we're obligated to pay for that position for a number of days.
Right.
That allows them the time to move into whatever position if they go to another federal facility or whatever that is. And so through the contract, we're obligated to pay that salary for a number of months, actually, until that transition happens. And what we do is we pay the federal government. The federal government pays that employee, and then they
Right.
bill us back for those services.
Okay.
That's how that works. That's what the agreement is. We don't actually run the HR system. They go through a different
Right.
HR system. All that stuff is handled separately from us.
Okay. All right. Appreciate it, Speaker.
Counselor Dobbins?
Yes, Dr. Jones, in our clinics, is there any physical closeness between our insulin and our flu vaccines? Here's what happened in Bartlesville.
I heard about that, but we haven't had any issues with anything like that. So, but I was made aware of that, what had happened in Bartlesville. It's kind of a strange situation.
Amazing, there weren't any fatalities.
Yeah, truly.
Counselor Buzzard? Counselor Buzzard, yes.
I know we've talked about this before, Dr. Jones, but I've had another call about walk-ins at some of our clinics. And the way I understand it, there's, on a certain day, there's a limited number of appointments that can be made.
For which service?
Medical.
For medical, okay.
But then the person that called me said, well, by the time I go in for a walk-in, all the appointments or all the open places or all the open slots are taken care of, and then I can't get in as a walk-in. Now, I know we talked about this before. Our policy is that they'll see somebody if they walk in. They may have to wait for a few hours or whatever, but they'll eventually be seen by triage.
Yeah, and I can find out for you if you'll give me some information, and I can check into it and see what happened and what day it was, or, there are
And I don't know
some
those
cases where,
particulars. It was just a patient called me, and actually it was over at the Salina Clinic. She said, I go down there to walk in, so I can't get in because all the slots are taken up by people that's called in at 8 o'clock or 8:30, and they fill those appointments and I can't get in. I said, well, I think eventually you'd get in and probably see be triaged anyway.
yeah.
I don't know what the solution is to it.
They have so many same-day appointments
Yeah.
every day. But as far as the walk-in and stuff, it would depend on what providers are there. We've had some situations in the past, this doesn't happen very often, where you have, a perfect storm where you have a very limited amount of providers in the clinic, but that shouldn't happen very often, so.
And I know, I told her I didn't know what the solution was. I thought if they went in as a walk-in, they'd eventually get seen.
Yeah.
Maybe not the time they want, but eventually would. The other thing is on mental health. I know we talked a little bit about that, but are we going to replace used to be the psychiatrist here?
We've actually got 2 psychiatrists that we've just employed and a children's psychologist.
Okay, good.
So we have been successful in recruiting those, and we've got the contracts written, and they'll be starting very soon.
Good deal.
Okay.
That's good to hear.
Yeah.
And the other thing, and I brought it up, and you may not have had time to do this, but those signs for a veteran and then the expected mothers, have you had some discussion?
We did talk about it, and it's just something that we need to get off the ground and get moving
Okay.
on, so it's on our project list to do.
Well, I'll remind you.
Yeah,
Find
so
out.
we'll keep it on we've got a long project list, and some things get moved to the top, moved around depending on the severity of what problems are up there, but it is something that's on our list to get done.
The other thing that, I know we're gonna have a lot of vacant spaces. People are gonna be moving from this office or from Marcom, are gonna be into the new building. So what are we gonna do with the people that's gonna be moving from places that's going into the new clinic, like Marcom?
That I don't know, because Health rented that. That belongs to facilities or belongs to a different department of Cherokee Nation, and we just rented that space through Health. So I don't know what the plan is for that space. We're trying to move as many people as we can, as many services. Well, the directive was to get everybody with Health onto the campus. So we're trying our best to get everybody moved in the next month to a month and a half to get everybody moved onto the Talpal campus.
Is there an exercise place in the new clinic?
There is an employee area for,
Okay.
area for employees to utilize, yeah. But we do have, a physical therapy area and stuff like that for people who are going through, that need physical therapy. But as far as a gym or something like that, no, but there is, the area at Marcoma is still available here.
Okay, I just thought that.
And we're not moving the gym, that is staying at Marcoma, yeah.
And especially for diabetics,
I don't know.
I guess that was the diabetic place at Marcoma. Is that where diabetics met out there?
No, they've met at Hastings until we had to move them around when we took down the building where the med school's going.
Yeah.
Then we had to temporarily move some of those services offline over to the Bill Willis Center, and now they're moving back onto campus. Like I said, today orthopedics and podiatry moved into the new building where they were temporarily dislocated into that annex building.
Okay. Well, I'm certainly glad to hear that we got 2 psychiatrists coming aboard. Mental health is a big issue, and it's, I just think we need to be more cognizant about it and help those people, because I know a lot of them need help. But I appreciate what you've done.
Yeah, and Dr. Montgomery and Ms. Skinner, I think Ms. Skinner's there too, are out visiting the Eastern Band. That's why he's not here today.
Okay.
On behavioral health, looking at behavioral health grant that we've gotten, how they've implemented it there.
Yeah, and Eastern Band have built a mental health facility right next to their hospital there. But
And
anyway,
that's what they're touring.
Oh, I see.
Yeah,
Okay,
so.
thank you. Thank you, Madam Chair.
Counselor Crittenden?
Doctor, I just want to thank you again for arranging that elder ride for me.
Sure.
Big deal. And now you said we got 2 audiologists now?
Mhm.
Now,
Got
we
2
got
audiologists.
1 for how long?
Well, we had 1 because we didn't have space for 2. And as soon as we moved over into the new clinic, now we have space for 2. So,
Snuck that in rather calmly. That's a big, big deal. Huh? You
Well,
should be wearing a T-shirt.
there's
that says
so
that.
many. I can't. I don't have enough time to give you all the things that we're doing in this small amount of time, so I just kind of hit the highlights.
Are you already
because
seeing some
we.
relief of the
I haven't been that granular into it to see what the relief is, but just like anything else, as we improve access, we also have a bigger supply, a bigger demand on the system. When we opened up the MRI machines, this is a prime example. We have 2 MRI machines. We got those online and started utilizing the MRI, and in 3 days we had 100 referrals. So we don't know what our demand is. We've never been able to measure what the real demand for anything is. So as we build these facilities and as we open up services, that demand increases too. You can look at J Clinic, and they built that clinic, and we thought it would take several years to get capacity, and within 3 years you're almost at maximum capacity. So Oshaleta's kind of the same way. It's almost to capacity. It's just one of those things that it continues to, the demand is great.
Thank you. I mean, that's a great deal. But the contract health folks, your team, man, they've been great to me. One thing, and I know it's a thing because I hear about it quite a bit, but just the folks that come in and get a referral to Tulsa. Sometimes, we're referred out to Tulsa, and that doctor says, hey, come back in a week and check the cast and this and that. I think we could educate the folks a little more on, hey, by golly, this referral's to go see. Whatever he says don't mean diddly unless you come back and get another referral, because I think the folks need a little bit more education on that.
Yeah, and we've identified that as an issue. So One of the things we're doing in this reorg is we're adding, I talked a little bit about having someone in our system that will be an advocate for contract health only, to help people work through those processes, work through the appeals process. A lot of people don't understand how that works. So that's a piece of the puzzle also. The other thing we're doing right now is doing a similar time cycle study that we've done on some of the clinics on the contract health process. Where are our bottlenecks? What can we do to speed that process up so someone isn't sitting and waiting on a referral? What is it that we have control of, and what can we do to fix that? So we're currently looking at that right now and having Mr. Carey go through and do time cycle study on each step through that process and see where the bottlenecks
There
are.
wasn't a jab at him. I know Kana mentioned it the other day. He really tries.
Yeah,
and I
he's
appreciate it.
doing a good job. It's just, we've got to find out where those bottlenecks are so we can open them up and free up that access.
Thank you. Thank you.
Anybody else have any questions?
I have a comment. Two things. We had Mercy Health officials, the CEO and CFO here last week, and appreciate you giving them a tour.
Sure.
They were quite impressed. They just hired 2 neurosurgeons, and they were looking to see if there's any way we could work something out, some type of agreement. But after they saw what we had to offer, they said, we need to learn from you, what you guys are doing
Good.
here. And the second, this public health is working with Sequoia High School to employ an aquaponics system in their greenhouse. Is that already up and running?
I don't know about that. I'd have to get with Lisa on that. That'd be through her department, through public health,
Yeah.
so I'm not aware of that.
We had some examples of those a couple years ago brought to the council, and we looked at those, and I thought we had one in place here on right here at the complex. So, just if you would give me an
I'll find
update
it.
on that, see where we are with it. Thank you, Madam Chair. In the Thursday event, that will be inside, correct?
Yeah.
Okay.
It'll be in the main foyer
Okay.
there in the new clinic.
Dr. Jones, on Thursday, what groups are still going to be needing to move into the new clinic?
There's quite a long list of folks we're still moving in. I think the next group that moves is going to be, I believe it's pediatrics is the next group that's going to be moving. We do have some pods that we haven't assigned. They're specialty clinic pods that we haven't assigned yet. The main thing is getting a lot of the people that are already in Hastings moved over. Orthopedics was high on the list because we had already displaced them whenever we tore down the building for the med school. So right now, behavioral health and dental are up running full steam. Primary care came online and resident clinic a week and a half ago, and they're just now starting to ramp up. And like I said, lab's been there, radiology is there, and orthopedics and podiatry started today. So we still have quite a bit to go to move things around the way they're supposed to be, but it's gone a lot smoother than probably we anticipated, just because of all the preemptive day in the life exercises that we did and things of that nature. But there's still a lot of little bugs to work out, and a lot of flow issues that we're still working through, but they haven't been really disruptive like you would think, moving a big service line like that.
Are patients being notified of which building to
Yes.
go to?
Yeah, and those schedules were built out long before our move. That's why we've planned on these transitions being incremental like they are, and we didn't just throw everything in at the same time. And the patients are notified of when their next appointment will be and where it's going to be at. Pharmacy is up and running. It's not at 100% capacity yet, but it's getting closer every day.
You said that there's a shuttle service now. Did I understand that correctly?
That for Stillwell. There will be a shuttle service because we're going to have employees parking off-site, and so we're putting together a shuttle service that'll take employees back and forth to their cars.
Do you anticipate any problems with people walking the great distance, first off, in the clinic because of the size, and then the scope of that parking lot?
Over in Stillwell or here in Tahlequah?
Here in Tahlequah.
Here in Tahlequah. So one of the things we did for the clinic, and if you come over, you can see we have some wheelchairs that are, mechanical wheelchairs. They're the battery-powered wheelchairs for patients that need assistance. So our greeters and our wayfinders identify those patients when they come in the door, and they check one of those out, and they can use it for whatever they need to throughout our clinic, and then check it back in when they leave. So we've anticipated some of those long walks for patients that are having a little trouble with that.
Very good. By any chance, have you anticipated the need of an art directory?
Art directory.
To find an artist's work, because, I mean, it's like a gallery.
Oh, it is. It's beautiful.
It's spectacular.
Yeah, it is, and it really brought the building to life when they started putting the artwork in there. So all that's done through Gina and her group. We don't have anything to do with that. They categorize it, and keep. My understanding is from time to time they may switch pieces out and move them from one place to another, but we don't really have anything to say about that. That's all through their group.
They've done an amazing job. I'd like to talk to you about pharmacy counseling. I've been informed that patients are required to have pharmacy counseling when they're not even when it's not a new script or it's not narcotics, and that they're being told it's the law and it's our policy. Is that correct?
It is our policy. I don't know about if it's the law or not. I do know that we have an RFP out right now for a consultant group to come in and help us look at our pharmacy services and see what we need to do to make us more efficient. One of the things that we've looked at with counseling in particular is a telepharmacy prototype, so to speak. We're getting ready to start it, and we're going to start it in the new clinic, in one clinic, and to see how it works. And basically what that'll be is the pharmacist will be at their location with a webcam, basically, where when the patient's done in the room, we can hand them an iPad, and it will pull up like Skype, and they can do the counseling right there. And then when the patient gets down to pharmacy, their medication, they don't have to wait on the counseling because it's already been done in the room. So those are the things that we're looking at to try to speed up the process, so a patient doesn't have to go down and wait for a pharmacist to come available before they can get their medication. So we've identified that there are some holdups there, and we don't want. The other thing I don't want is a pharmacist spending all their time walking around the clinic trying to go to wherever they're supposed to go to do the counseling. So if we can do it with technology, it's going to save time and money.
I just didn't understand the need of having counseling if it's not a new prescription.
Yeah, I don't know the law on that for sure.
It's not the law.
Yeah, I don't. I know that when I've gotten prescriptions out, I haven't necessarily gotten counseling when I've gone to a private pharmacy. So, but it is a policy that we have right now. So, if it's something that we can loosen up or make it a little easier for our patients, then we are definitely going to look at that.
Is it a tribal policy?
I think it's a Cherokee Nation
Okay.
policy. Yeah.
I appreciate you checking that out. Councilor Shambaugh.
Unless you've changed it, because I've been to the clinic before and I've got medication and it was a repeat thing. They don't actually sit there and just, if you've been there several times, they said, well, you've done this, and if you don't want counseling, you've already had your medication, you can sign here saying you do not need counseling. And that's what I always did, and it took a second, and it wasn't, they might have offered it every time, but since you've been there many times, you didn't have to sit there and listen to it. You could just sign off for it. Is that kind of the same thing you're doing?
I'm not sure that it's consistent from place to place, because I know in some places they want to meet with every single patient, and another place it may be more like that. So
well, it was here where I went in the old clinic,
right.
And you would meet with the pharmacist, and they'd call your name, go in there, you meet with the pharmacist, and of course they had your history there, and you'd be in the doctors. Maybe they had their notes, but they knew if you had been there numerous times, and they knew whether they needed to talk to you or not, and they gave you that opportunity, since you had been counseled already once, to go ahead and deny that and just get your medication and go on.
And that,
if that's the same thing?
I don't know for sure, but I will tell you that that's something that we've identified again that we need to look at, and so we wrote an RFP to have a pharmacy consulting group come in and help us, because I'm not an expert in pharmacy, but there are experts out there, and they can tell us what we really need to be doing and what we really don't need to be doing, what could be more efficient about our system. So, one of the things that if you're not the expert, you should find the expert and let them guide you, and that's what we've already initiated that process.
Thank you.
Can you tell me if we're going to have, or do we have, an Alzheimer's support group or any elder advocates?
I don't know if we have a support group that would be through behavioral health. I'm sure if we do, and I don't know the answer to that, but I can find out.
Thank you very much. I've mentioned this before, and again, it's happened. If we could possibly make it with that, when an at-large citizen is referred outside of our clinics, that they sign something that fully makes them aware that they're responsible for the charges that they incur. That would be very helpful, because it's happened a couple of times again. And if you could check that out, I'd be really grateful. It would be so beneficial that the people know what to expect rather than be surprised. And that's quite a surprise when you think it's being covered. Yeah, just something where they can sign, maybe, on an electronic thing or something.
Okay.
That would be awesome.
Again, contract health is a very confusing place, and for all of our people who utilize it. So, again, that's one of the areas that we identified that is a place where we have a problem communicating efficiently and clearly. So that's something that we're definitely looking at improving.
I appreciate it. Question on the flu shots. Are we doing second flu shots for the elders, our elders?
Not that I'm aware
or did
of.
we have enough flu vaccine that they got the higher dose to begin with?
I don't know the answer to that. I'd have to find out. That would be a Dr. Montgomery question, and he's not here today.
He's
so,
in, Cherokee, North Carolina. And then someone asked me why they had to show their blue card at the optometry department.
The only thing there are specific, if you're going to get your glasses there, your eyeglasses there are policies that are limiting to who is eligible for those and who is not. So that could have been that they fell into one of those policies and they had to verify that they were a tribal citizen and they fit into one of those groups.
Okay.
That's not open to just everyone. There's specific categories that you fit into to get your glasses for free.
I think that's through the motor fuels compact.
It had eyeglasses, dentures, and hearing aids.
Yeah.
Our cardiology department, are they reporting on Cerner now?
They record their information, their reads and stuff on Cerner to us, and our halters and things of that nature. If we refer them out, then we get a referral, information back from them. But the cardiologists that we refer to actually work down at NHS, so through the Heart Center. So we don't have someone who's just specifically working in our system that reports directly on to Cerner. I think that information is brought into and imported in. We do have device clinic where we do have someone that comes up and meets with everyone that has pacemakers and things of that nature, and they record directly in. So some yes and some no, I guess would be the way to answer that question.
Do we have the cardiology program on Cerner?
We have the ability to put. That's an interesting question. So if you're talking about the imaging and the ability to transmit images or diagnostic tests, yes, we do that through two different programs called Epiphany and Fuji. We don't own those. CHP owns those, or I guess NOD owns those, and we own a piece of that. But it's a little convoluted on how that works. But we pay a per-click fee for using that software. We're looking at currently at getting our own software and getting away from that system. We're bidding that out currently with Cerner.
I was just thinking it would be more economically feasible for Cherokee Nation to have the Cerner unit in cardiology rather than pay that.
Yeah, it would, and that's why we're looking into it. Like I said, these are service agreements that we're looking at to see what's more efficient. I think when those were put in place was back when we were on RPMS and we didn't have the capacity to do that. So now we do, but of course there's a cost that goes along with owning that, the ability to do that.
And speaking of cost, do we own or have interest in the MRI equipment at Northeastern Oklahoma Health?
We don't. Cherokee Nation, that's a interesting question on how to answer that. There is an entity that owns that equipment that leases it to NHS. Cherokee Nation owns a very small percentage of that entity. So we're working on clearing all that up through Cherokee Health Partners and getting all that straightened up as far as being able to show it this is exactly what we do and what we don't do. But the machine itself, no, we don't own the machine. We don't own the business that runs through Northeastern Health Systems.
Except for cardiology, can you tell me other areas that we're going to be still involved in after the new clinic opens with Northeastern Oklahoma Health?
Currently, we're involved with ENT. We have an ENT doc that works through Cherokee Health Partners, and I think cardiology. We do some nuclear medicine through our CHP service. I think that's about it.
Thank you for that. Okay, I'm done with my questions. Counselor Buzzard?
Yes, Dr. Jones, could you check on the TVs there at the J Clinic? I want to understand that they were TVs ordered for the waiting room, but when they got the TVs in, they weren't compatible with whatever IT hooked up, and then I don't know where the TVs went.
Okay.
But we'd like to get them reinstalled because of the information that the Cherokee Nation puts out. We feel like we're missing, I feel like, and a lot of patients feel like they're missing out on a lot of information that,
Okay.
that used to come on those TV programs. So I'd appreciate it if you could check and even get some in there if we can do that.
Okay. I wasn't aware of that, but I'll check into it.
Appreciate it.
Okay.
Thank you.
Okay, anybody else have any questions? Thank you, Dr. Jones.
All right, thank you.
Appreciate it. Okay, any old business, new business? Announcements, we're going to all meet at 11 o'clock at, do you know where that's going to be, Dr. Jones? Is it going to be in front of the new clinic on Thursday?
It'll be in the
Atrium?
Atrium.
At 11 o'clock on Thursday. And our next meeting is tentatively scheduled for Monday, December 16th at 1 o'clock.
Make a motion to adjourn.
Motion made, seconded. All in favor? Aye.